Vitros automated workstation. Before beginning any patient testing, ensure that all necessary components are available. The first reagent needed are the slides, on which chemistry reactions take place. Slides are barcoded with a specific label for each test. This test package is for the analysis of phosphorus and labeled with a catalog number or a lot number. New unopened test cartridges should be removed an hour in advance from the refrigerator in order for the reagents to come to room temperature. The cartridges of test slides here are for protein and ALT. Each of the specimens contain numerous slides, and it may vary between 60 and 100 slides per delivery unit. All the cartridges are barcoded, and the barcodes are significant when inserting the cartridge into the analyzer. The second reagent is an electrolyte reference fluid and is required for the measurement with ion-selective electrodes. The specimen rack contains the specimens that will be analyzed that day. It is very important for these specimens to be labeled by giving each sample a unique number and recording this number on the worksheet. This is the sample carrier for the Vitros. A sample cup can be inserted into each one of the positions on the rack. Also needed are the dilution trays, the Versa tips for sample delivery, the sample cups for holding the patient specimens, and the Vitros microtips. The desiccant pads to the right and the humidity pad to the left help in maintaining correct humidity levels for the reaction to take place. Before beginning, it is good practice to ensure that there is ample supply of paper in the printer. Ensure that the instrument is turned on. This instrument is a discrete analyzer. That is, each test is handled individually within the analyzer, and it can perform as many as 100 different chemistry tests. The Vitros is composed of several different modules. Let's examine each module of the analyzer. The first module involves the reagent delivery system. The sample track is where the rack is placed for analysis by the analyzer. Slide it into the correct sample track. The transport tray will come and pick up the sample rack and then deliver it into position for sampling. The sample arm will come and pick up one of these Versa tips, bring it to the transport tray, and pick up a sample to bring to the delivery system. The microdilution arrays are where the actual dilution takes place, should it be required. This tray holds all the dilution fluids. Each position is specific for a different diluent fluid. The second module is where the reactions occur. This here is the ISE chamber. Here is the electrolyte reference fluid, which must be changed before every run. This is the slide and sample area. The slide will be brought to this area, and the sample will be deposited by the delivery system onto the slide before the reaction occurs. For testing to occur, both of these doors must be closed. Notice to the side there is a door sensor. If the door is not closed, there will be an error message and the run will not be completed. The command console allows for the user to interact with the analyzer. It is composed of two main sections, touchscreen monitor and a keyboard to enter data. This module is used for waste disposal and humidity control. These two containers here are for slide supply 1 and slide supply 2. They are used to control the humidity for each of the slide supplies. These two containers are for waste disposal and slide capture. The final module contains the electronics of the instrument and should never be opened. Daily maintenance involves the following. First, ensure that humidity control packs are within their compartments. To accomplish this, you must pull down and then pull out. Make sure that all the slots are full and insert it back into the instrument. To insert the holder back into place, push in and push up. Repeat the same steps for the second pack. In this case, all of the desiccant pads are present. Remove the slide waste disposal and empty the slide cartridges into the biohazard waste container. Replace the waste disposal unit. The next step involves changing the electrolyte reference fluid and the microtip for the ISE chamber. From the main menu, select Periodic Maintenance, then Daily Maintenance, select Fluids, and then select Reference Fluid. First, obtain a new microtip. Remove the old microtip and discard it. Firmly push the new tip in place to ensure that the tip does not fall off. To replace the reference fluid, remove the packaging and remove the black top. Remove the old fluid and replace it with the new one, closing the top afterwards. Return to the screen. It will ask if the fluid reservoir was replaced. Select Yes and hit Enter. Now touch Return twice to exit to the main menu. This completes the daily maintenance. When using new slides, ensure that the slides have been taken out 1 hour prior so that they may warm to room temperature. Ensure that you have a normal and abnormal quality control to run with the specimens. These controls should accompany each run. On the left of the rack, we have a bar-coded Vacutainer tube with an aliquot of serum or plasma. In the hospital setting, there will be an HIS connected to the LIS. Each requisition in the hospital setting contains patient demographics and also the tests required for analysis. The barcode is the interface between the Vitros and the LIS, and it informs the system which tests need to be completed. In the Cambrian laboratory system, the system is manual, and the Vitros system is not attached to an LIS. Begin by assigning a number to each specimen in your specimen tray. Good practice is to label the tube and not the lid, since the lid can easily be lost or mixed up with another specimen. Your work list should be in the form of an Excel spreadsheet. On the work list, identify the specimen number and also record the patient ID. Be sure to record the quality control results. The purpose of the worksheet is to record the test results for each patient. You must always identify the sample cups so that patient specimens are properly transferred. Wearing gloves, use a transfer pipette to transfer the appropriate volume to each sample cup. Good practice is to place the specimen at the back of the rack once it has been transferred to avoid any sample mix-up. Always use a new transfer pipette for each sample and discard the used ones in a biohazard waste container. Make sure to include a normal and an abnormal quality control sample in your run. The sample to the right is the first sample that will be introduced into the delivery system. Perform a final check to ensure that the number of samples in the tray is equal to the number of samples on the worksheet. The tray is ready to be introduced into the Vitros in channel number 1. Before running tests, new slide cartridges must be loaded onto the Vitros. The color on the barcode must be associated with the proper slide supply. The cartridges will have a barcode, and each barcode will have a color, either yellow or white. This cartridge has a yellow barcode and must be inserted into the slide supply 1 on the analyzer. Match the color on the barcode of the cartridge to the color of the slide supply on the analyzer. To insert the cartridge, make sure to have the barcode side facing the back of the unit and push down quickly and firmly. The cartridge will be taken into the instrument in a few seconds. Repeat the same steps for the white barcoded cartridges by inserting them into slide supply 2. The yellow and white cartridges may be inserted at the same time. However, you must wait to insert another cartridge until the first one has gone into the analyzer. Once all the cartridges are installed into the instrument, patient testing may now take place. From the main menu, select Cartridge Handling, and then select Slide Inventory. This will give you a list of cartridges loaded onto the instrument. This list can be printed to ensure that there are enough slides for the number of samples that need to be tested. begin programming the specimen list, touch Sample Programming, and then Tray Name. Enter a name for your tray, and press Enter. Notice that positions 1 to 10 will show up on the right-hand side of the screen. Selecting position 1 will bring you to the screen that allows test selection to take place. Begin by entering the sample ID from the worksheet corresponding to position 1 and press Enter.
Now you may press enter. You may need to
The fluid type can also be changed from serum to urine to CSF by touching the fluid button. The sample type restricts the type of test that may be performed. Once the patient ID and the fluid type have been entered, test selection can be done in one of two ways. Test selection can be done on an individual basis, selecting one test at a time, or the Display More tests can be selected from the bottom of the screen. Tests can also be selected from a set panel. In the Cambrian laboratory setting, tests will be set up individually according to the worksheet. Should a sample dilution be needed, the option for a test dilution is on the right-hand side of the screen. Enter the appropriate dilution, and the instrument will dilute the sample accordingly. Once the required tests have been selected, press Enter Program. The screen will skip to the next position on your rack. Once again, make sure the appropriate fluid is selected, and all the required tests are highlighted before selecting Enter Program. Repeat these same steps until all the samples have been entered. Once the tests for all patient samples have been entered, test selection for quality control material will take place. Test selection performed on QC1 and QC2 should include all the tests performed on patient samples. Remember to touch Enter Program to complete the test selection. Repeat the same procedure for QC2. By touching Return, a preview screen can be seen. By touching the tray name and then selecting the track for the run, a preview will let you know if more slides need to be loaded before beginning the run. Once all these steps are complete, you can now press the On sampling at the top of the screen. The green LED light should be on, indicating that the tray is ready to be picked up and analyzed. When testing is complete, remove the sample holder and discard the sample cups in the biohazard waste.
into the biohazard waste.
To empty the cartridges from the supply unit, touch Cartridge Handling and then discard cartridges by supply. Select Yes to unload the empty and partially empty cartridges from the analyzer. Once completed, it will ask to unload the slide supply too. Touch Yes. Open the door and remove the cartridges from the container. Remove the cartridges to examine and discard the empty ones. The cartridges containing slides should be stored as indicated by the manufacturer. Replace the holding container and close the door.